enjoyed the whole thing really. The speakers and the talks have been really good. I've learned quite a lot from them.
My highlight personally was the cadaveric workshop at University of Queensland on the Friday, where we got 40 delegates to come and look at cadavers and fresh cadavers, and we got to needle them, and we got to ultrasound our models, and we learned a lot about anatomy and learned a lot about regional anaesthesia and how to perform blocks. But I've really enjoyed coming to the lectures as well. I think there's been a really diverse subject matter within the lectures. It's been enjoyable to see more female speakers.
So the two talks that have really excited me are Jenny, I want to say Jenny Weller, but it's not. It's Jenny Martin's talk on gender equality in conferences and getting women speakers up to the same number of women as there are men. And the other one was Lorelei Lingard's talk on teamwork and how we assess teamwork, and the fact that it's not as easy as we thought it would be.
Yeah, no, it's been good fun. It's been a great conference. Having no children has been awesome. But I appreciate the creche. That's been fabulous. There's been lots of females in our Medical Mums Facebook who are here, who have brought their children and sent them to the creche.
The meeting's been great from the pain perspective. We've had lots of good discussion about some of the issues of controversy, so particularly around cannabis and around outcome measurement from procedures. So good to think about what we might say as a faculty of pain medicine about cannabis. Should we be helping with some of the research questions rather than simply saying there's not enough evidence to use cannabis for chronic non-cancer pain? So starting to think through a little bit more of the detail of should we, from the faculty perspective, support a registry nationally for cannabis use in chronic non-cancer pain. That would help to get some more information. Or should we be doing some smaller N of 1 trials? So that zone's been interesting. And also the debate from the procedures perspective, should we be helping those of our fellows interested in that zone to drill more into outcome measurement? So these are political, topical issues, so that, along with meeting a lot of people and having some conversations, is all part of the fun of the conference.
It was a slightly sobering talk this morning we had, including discussion of some of the fraud that's happened in medical literature, and I suspect that actually what anaesthesia has done well actually finding the people who have been committing fraud. We've had the focus of the meeting been on big, so there's been some good discussions about obesity. Really interesting discussion from one looking at causes of obesity yesterday, and again with a view to how that can affect what we do with anaesthesia. Yeah, no, I've enjoyed the different talks. I went to an excellent session on CT interpretation of airways in one of the workshops. Had a really good day of workshops. So that was probably actually one of the highlights for me, was the workshop day.
Well, in all honesty, I think the workshops is where we learn to improve our clinical skills and our knowledge, and the lectures are more thought-provoking and you know, we're looking at anaesthesia conceptually in our lectures, but the workshops are very important for us to actually improve our clinical practice.
I've liked the variety. My favourite talk so far has been the talk on big data. It was very different to what I expected it to be. I enjoyed seeing Tim Cook, who did all the NAP work in the UK.
So he's been talking about the national audit projects in the UK, which have been fantastic, just collecting big data about safety and anaesthesia. Very interesting and somewhat parallel to some of the work we're beginning to think about in the pain zone with our EPOC outcome measurement and benchmarking systems.
So far it's been absolutely brilliant. It's a lovely city, a lovely conference centre. I can't fault anything. Wagyu beef and Guinness pies, they were really good. I really like them.
Yeah, awesome.